In this video, I talk with Dr. Joy Kong. She is a triple board-certified physician who specializes in anti-aging, and she talks about the 3 fundamental pillars to staying young. Stay tuned. Okay, welcome, Dr. Joy Kong.
Just a little bit about myself. I'm an anti-aging specialist, and also I'm very much focused on stem cell therapy. So I went to UCLA for medical school and did residency in psychiatry. So I was board certified in psychiatry, and I also got board certification in addiction medicine. And after that, when I found anti-aging medicine, anti-aging and regenerative medicine, and that's where I got my last board certification, and that's where my passion is at. So helping people stay healthy, that's my mission now. 4 years of residency, 7 years, working as a psychiatrist. But in the meantime, I was trying to integrate a lot of the holistic aspects of medicine because, growing up in China, I know that just, our brain is not functioning alone. It's connected to many organs and many systems. The medicine see it, but the Western medicine doesn't quite see it the same way. But I wanted to bring that more holistic approach to the brain, but it was difficult to do in the mental health setting because I was working in a clinic and a hospital, so I didn't really have my own private practice. And when I heard about what the approach was and the entire philosophy of anti-aging medicine, and that's exactly what I wanted, because we're going for the fundamental causes of our decline, which are the causes of our diseases. And if we can address all that, we're helping everybody, and we can all live, longer and healthier and prevent a lot of diseases. So by going into the different individual causes, I can address different organ systems all at once. That's really what I'm looking for. But then because anti-aging medicine was based on scientific, studies, it's a branch of medicine. So they were looking at a lot of research and really digging deep into the scientific basis of everything that they're doing. So, they were looking at mitochondria health and, telomere, reactive oxygen species, and stem cell therapy. So all these, and nutrition, everything science-based. And I just got really excited.
You'll hear a lot of people will say, oh, I don't have a chance because it's genetic. How much influence do we have on how gracefully we age?
The more we know in science, the more we realize how much the environment actually dominate. The genes are a factor for sure. I can't exact percentage, but if I have to, I would say about 30%. I would say that it's a smaller amount. More has to do with how you can modify the gene expression by what you do, because there are a lot of things. The genes are there. The particular the base pairs are arranged a certain way, but whether or not they're turned on, how they're expressed, are all controlled by all these factors that you can still control. So I think there's a lot more people can do. And to just throw your hands up saying, it's my genes, and then I think that's irresponsible.
A lot of people say I look like early 40s, but they all know I do keto, I do fasting, I do like sauna detoxes. I'm always talking about like cold showers and heat genes and all this stuff. And I haven't always lived like this, but I think if you live that way, this is actually a question. If you live that way most of the time, do you get the benefits? People be like, I can't do this all the time, but do you believe in the 80-20 rule, the 90-10 rule?
Yeah, I think it makes sense. There's still a psychological factor, right? So my way of breaking down my rules is when I, let's say, if anything that's going to give me a cultural experience, then I'm not going to turn it down, right? And that's one exception. Another exception, if I'm going to a restaurant, if I'm going to this creative, art as food, then I'm not going to turn it down. I'm going to eat the damn dessert because someone made a piece of art out of it. but those are the only times. I don't have any candies. I don't have junk in my house, nothing. So if I'm really hungry, maybe I have some nuts, lying around, a piece of fruit. That's all.
What are your top, say, 3 or 4 ways to kind of reverse the aging process? We talked a lot about nutrition, but kind of take us through the different ways that you see people can really.
Yeah, actually, I give people, because people all come to me for stem cell therapy. So, and then a lot of them is, for either helping with their chronic illnesses or for anti-aging purposes. So I have pre and post treatment recommendations. It's really the same thing. It's very basic, and it's really the most important aspects. So first of all, nutrition is really important. You want to eat things that are anti-inflammatory, that's going to give your body nourishment, not excess calories. But and that there's a whole set of good nutrition. And then the second part is you've got to move your body, because when you move your body, you're activating a lot of genes, over 400 genes in your body, and that's going to activate the regenerative process and anti-aging process. So you got to move. I really ideally people should do something every day, and the whole 3 to 5 days a week, that's for convenience. People already move very little compared to our ancestors. So, doing a little bit every day is no big deal. I actually do Legree Fitness, which I love, and it's only 40 minutes a day. But then I have to do it every day because I know how much it's doing for my body, because the rest of the time I sit around so much, I'm always reading and, doing work. And then another thing is detoxification. So you got to get rid of the toxins. For me, I recommend, I do infrared a few times a week, and that's what I recommend to patients, because it's a really safe and kind of an effective way of doing detox. Very gentle. You can probably achieve pretty good benefit by using infrared sauna, and it doesn't get rid of just the heavy metals, but also the organic toxins and all, the pesticides, all the things that are difficult to get rid of. So those are kind of the 3 pillars.
If the viewer or the listener is not familiar with like how damaging chronic inflammation is, talk a little bit about that.
I will look at inflammation and aging. Really, they're very similar. Where inflammation is one aspect. Aging. There's many aspects of aging, but the aging process is the process of decline, and the inflammation drives that decline. So it's almost like, there's no such thing as healthy aging. Aging is a problem, and illness itself. It doesn't manifest as drastically, but if you look at people's inflammation markers when they get older, that's how healthy, how age appropriate, how active they are, their inflammation markers are getting higher and higher because they're aging. The body is changing, and everything in their internal organs. People think, oh yeah, getting older and more wrinkles, the hair getting gray. That's just the surface. All your organs are getting older and older. So people are not thinking about that. So it's almost like when you actually get sick, that's just a culmination of the aging process, and then something made it really manifest. So you can consider the inflammation and the aging process as the smoldering fire, as the fire, and the disease as the smoke. So it's only, the fire is always there. You may not see it, and you only see it when the smoke comes out, but you've got to start calming down that fire.
And then you mentioned movement too. I absolutely agree. I mean, we don't move very much as a society anymore. Or we don't sweat very much. You talked about the infrared sauna, and I've read some articles about, it's interesting how we just don't really sweat anymore, because a lot of us have inside jobs and we sit at desks where we used to be out.
Interesting. I haven't thought about that. Yeah.
If you're not sweating, then how do you get rid of these toxic chemicals? Do you just? Well, there's
some, it can come out, from, yes, it can still come out from your follicles, but not very much, and your urine, your feces. So you can still, get rid of some, but it's drastically, it's not very much. Apparently the sweat function is extremely effective.
Okay. So moving into your specialty, this is, first of all, let's just get out the, let's talk about the controversial thing, because I know as soon as you say stem cells, people, what they'll argue about where the cells come from.
Yeah.
Do you deal with that a lot in your practice?
Oh, God. I just received an email from somebody who wrote through our website and asking me, you're talking about umbilical cord stem cells. Isn't that illegal in this country? I mean, okay, so my job is to educate the public, and it's amazing how much education there is to be done. So the umbilical cord stem cells, I think people either, this person was confusing umbilical cord stem cells with embryonic stem cells, or she just doesn't know, the space at all. So the embryonic stem cells are obtained from developing embryo between day 5 and day. So when it's just a cluster of cells, so they take, a cell, from the inner cell mass, and then them. So that's early embryo. The umbilical cord comes when a baby is getting born, a healthy baby getting born. They cut off the cord. There's a placenta in the cord. They're going to throw it away in the trash as biological waste. But now they found out there's much regenerative potential within these tissue that it can help a lot of people by extracting elements out of it. So there are a lot of labs popping up in the U.S. So the lab that produced our product is FDA registered. Everything is under the FDA, supervision, and there are FDA guidelines. So yes, you can use any of these cellular products as long as you don't use certain chemicals, enzymes to that may change their structure, and you don't grow them. So because when you grow them, that process can also they cause changes. So you take them out the way they are, and you're giving it to people. You can give it to people, and we're not going to consider it a drug if you use these cells that have them perform the same function as how they were in the previous tissue. So then it's considered tissue transplant, and it's completely fine. It's been sold to doctors all over the U.S. as long as you adhere to those rules. If you go beyond it, let's say if you want to do something that the cells, you take cells from certain tissue and you put it back somewhere else, or put it back into the your blood vessels to let it go all over your body, it may be a little different, and the FDA wants you to conduct studies. So, and that's what our company's doing. We're doing clinical studies to get on the path of drug approval. So that's, but there's no such thing that as illegal. It just people just don't know. Yeah.
Can they model any other cell, or?
Yeah. So that's the fundamental. I feel that the legislation needs to catch up, because what we're getting from the cells is a very, very crucial type of cells called mesenchymal stem cells. They're actually the mass generation, since, from as a baby to, until we die, because these stem cells are all over our body. Anywhere there's blood vessel, blood supply, these cells, are huddling over the blood vessels. And at the time, before they get out, start moving around, and they're just outside the blood vessels. They're called P-E-R-I. So they're huddling around the blood vessels. So they're looking, they're monitoring for signals. The signals can come from the blood cells, the blood, or other cells in the neighborhood. So these mesenchymal stem cells actually have hands, contacts with local stem cells. So in a way, they are conducting this. So they sense what the body says, what it needs to be done, and the local signals, and it talks to the local cells and secretes certain chemicals and instructing the cells to do certain things. So these are mesenchymal stem cells. So their function, how they work is really throughout the body. You have these everywhere. So when we get it from the umbilical cord, which is very rich, the cord tissue, very rich in mesenchymal stem, these cells are actually more primitive because they were sequestered early in embryogenesis. So they have more early markers. So they have more flexibility in how they're able to act. Of course, they're younger, so they're more potent. They're much more active. So you can use these cells, and they, when you put in the body, because they're performing similar functions. The pericytes, when they send certain signals, they get into the blood vessels, and now they're called mesenchymal stem cells. So then they're going to swim upstream to find the signal, where the signal is the strongest, and then they start to work. So in a way, they go to vessels, and they, and then they become systemic, right? They're in your system systemically. So in that sense, that's their function. They function systemically. So just give it systemically so these cells can find their way to the right place.
Say somebody comes to you with a chronic condition, like what would be something that they would come and stem cells would help them with?
So basically what I say is, does your disease have a component of inflammation and immune dysregulation? Because that's what these cells are particularly good at. That's what they do. They're highly anti-inflammatory, and they balance your immune system. So when even a person with a genetic disease, I'm not doing gene therapy. So I can't correct the genetic code, but I can address some of the sequelae of this genetic defect. That genetic defect could be causing inflammation and certain, immune dysregulation of the system. So then I can help address that. Unless we're addressing all the factors that's causing their chronic condition, then the chronic condition may come back, right? So that's why I have a comprehensive approach. I want people to address as many factors as possible. Diet is very important. If you keep poisoning your body, you're not giving the body the right tools to repair. Then it's going to slowly slide back. And if you're toxic, it's going to slide back. And if you have, different, let's say a hormone imbalance, then you're going to come back. Or your gut bacteria is in a functioning property. So you've got to address all those factors. The more we address, the longer your benefit is going to last. If we can address all of them, that's causing the disease, and then you may never get the disease again. But if you're not addressing anything and you're eating junk and you don't exercise, then the problem may return sooner because you are causing damage at the same time.
Just general appearance anti-aging. So somebody comes to you and they're already pretty healthy and they want to do stem cells for just anti-aging in general, feeling.
I have a lot of those. Yeah. And really the best time is when you're still healthy. And right, you want to prevent the aging process, prevent the damage. So most people who are for anti-aging, they're actually in pretty good shape and they want to stay that way. So they range from, very early 40s to, 60s. And they're just, that they're already taking really good care of themselves, but they want the extra. But of course, if you have illness, can calm your illness, can help, help you heal, but then also in the meantime, helping you with the aging process. So dial everything back, getting you to an earlier stage physiologically.
Yeah. Is it an IV or a shot, or how's it work exactly?
I do IV because I think that's one of the most powerful methods, from the research I've read. Even for brain conditions, it's very fascinating. When they were treating people with stroke, the IV injection of stem cells comparing to injecting directly into the brain actually gave people better results. Right. And what they realized was that, I think it's hubris to think that, we know the cells needs to be where, the problem is so that it can exert its benefit. And I think you're not giving full credit to how these cells actually work, because they realize cells talk to your entire body. It talks to the spleen, talk to all your lymph systems, and they have this conversation that can change your immune system, how it responds. And that immune system has a lot to do with the damage you get after stroke. These cells that come in actually cause more damage, but then these cells also need to be there to help with repair and removal of debris. So you have this dichotomy that the system can cause damage, can help you heal. So how do you modulate that? And these cells have the type of intelligence able to get your body more properly. It's really fascinating. People think, oh yeah, you need to be right there to become those cells. And that's really old thinking. That's some 10, 15 years ago, people thought that these cells function by becoming the new cell. No, we've known probably 95% of this benefit, or even more, is not by becoming the cells. It's by sending out signals to awaken your body's own ability to regenerate.
So back to, you said the 3 fundamentals. I'm going to jump back. What are your thoughts about fasting?
I think it's fantastic. I think if a person can do it, really great. I've done the most, I think, 3 days, and I have trouble. Maybe everyone's a little different. I just get, I get a little dizzy and I get really angry. And I wasn't sure why I was doing that, because literally like self-imposed torture. And my body really felt like it wanted some nutrient. So I think everyone should do it at their own pace. I would love to be able to do a 30-day fast, but I'm not sure if I really can get that accomplished, because my own body, I have a very fast metabolism, and I get into ketosis very easily. If I, fast for a day, and then, my ketone level rises up really fast. So I don't know. I don't have a good answer of what's really appropriate and how different fasting should be for each person.
Right.
I need someone to teach me on that.
Yeah, it's interesting. I think it's Johns Hopkins or Harvard or somewhere, the research that says if you fast for 3 days, they think your immunity system will regenerate within 72 hours, which is just, whether it does or not, I mean, it's early in the research.
Well, yeah, for sure. The autophagy, so eating yourself. And that's a really, really important, benefit of the fasting, probably one of the best, because we all get old. We start accumulating these senescent cells. The problem is they're old cells, and they don't just old and they don't work as well. They're actively toxic. They secrete molecules that cause more damage to you. So you got to get rid of them. And fasting is one of the best ways, because your body is looking for energy sources, and it's smart enough to know not to eat the good cells, but eat the the ones that are not doing its job.
Yeah, it's all really fascinating to me. I did a couple 5-day water only fasts, and
wow.
And I think I was dizzy and angry.
I'm glad I have a friend.
I know. All right. So my final question about stem cells. So if somebody is interested in doing this, how do you find a good doctor? Like, how do you know?
I think it's very challenging for patients, because I see these ads all over social media, saying this is how amazing and making certain claims. And I cringe, because I never make claims. You're not supposed to make claims when it's not approved as a drug, when certain things are not approved as a drug. So this is, very clear, just a law. I'm just trying to be law abiding. The thing is, doctors, a majority of doctors who are doing stem cells know very little about the science of stem cells. I would give it at least 90%. This is one reason that I founded American Academy of Integrative, because I saw a lacking. Because when I tried to learn myself, I had nowhere to go to. I just had to learn myself. So unless someone was as driven and obsessed as I was, reading articles after articles, accumulating everything and trying to understand the fundamentals, if they're just busy doing other things or adding stem cells, they really don't know. So that's why I put together a full day course where I teach them the science, the different types of stem cells, the different types of stem cell therapy, the pros and cons, and the evidence of each for each condition or each organ system. So when people finish my course, they take away over 280 articles, and that's, on various conditions. That's what research has come to fruition, right? So people spend years doing one study, and then that's that one article. So we got all these evidence out there. And then I talk about different things that affect stem cell therapy. There are a lot of, various factors, including medications, including, the energy medicine, or there are different, ozone therapy. So there are different things, and how do they affect? And then I give doctors the right protocols, because so many doctors are doing it very wrong. The cells function in a certain way. They're alive. So you need to know how to handle them and what is best for them. And a lot of doctors don't know. And then some doctors will push stem cells directly into the IV. They call it IV push, and that's extremely dangerous. Yes, maybe only 1% of the time you will get an embolus, but you don't want that to happen. You are potentially causing people harm. You need the right filter. You need the right solution. So all these needs to be out. The information has to be given to doctors. I would say, if a person is researching a doctor, ask a doctor, where did you get your training in stem cell therapy? Do you have a library of evidence? Do you have the protocol that's been endorsed by some kind of academy, right? So most doctors are not doing that, and that's very questionable. Are they doing it right, or are they just, a lot of people just hear say, hey, how are you doing stem cells? How do you give it to people? And it's become this just passing along information. Yeah, I'm doing this way, it should be fine. So no, you don't want that to be the way it's practiced. And really know what you're getting. And you need the mesenchymal stem cells. If you want stem cell therapy, you want the mesenchymal stem cells. And majority of the birth tissue derived products in this country is cord blood derived. And the blood, what's floating around the blood, the mesenchymal stem cells, is at most 1% when it comes to mesenchymal stem cells. There's so little. So that's all they talk about, which is what interesting. That's what those companies talk about, why their products work. They talk about mesenchymal stem cells. That's how I got started in the industry. Great, mesenchymal stem cells, wonderful. But no one would tell me how much of these cells, what's the percentage of mesenchymal stem cells in this product, until I actually cornered a CEO of a company and would not get off the phone until he told me the answer. And then he finally said, yeah, 1%. So I was very disappointed, because I knew how much mesenchymal stem cells was in the cord tissue, but he wasn't using it. So that's kind of what started me on my search of finding the ideal product, and eventually leading to me designing my own formula. So, I filed patent for my particular formula, which is the most comprehensive, includes most components from the birth tissue. They're synergistic. They work with each other. Cells talk to each other. And then I maintain environment of the cells as much as possible, including all the growth factors, all the, the serum of the blood, which is what nourishes the cells, in all your tissue. So I try to keep the cells in their niche, because all the scientists know the moment you take a cell out of their niche, they don't act as the same cell anymore. They act very differently. So you got to keep them in the same niche. And there are all these companies, they want to, it's either their technology limitations or it's a marketing scheme. They will have a product that just sells, and another product just growth factors. And if you use either of them alone, that doesn't work quite as well to put the two together. And it makes sense, because the moment you separate the two, the cells already are not functioning the same. You want to keep together. So I just think a lot of people, are doing things possibly for profit and not to look at the maximum benefit for patients. And that's all I'm about. I want to give my patients the best products. I want to give it to doctors to treat as many patients as possible. And I'm putting myself, I just want the best thing also for myself as well. So, that's basically my promise. I'm going to give you the best this country has. And I'm not going to stop. Actually, stop working with a particular lab because their quality was slipping. So I'm all outlook for the best technology, the most innovative approach, to get product to be better and better and better.
Well, this has been a great discussion. I want to wrap it up, but tell us all about your companies and where we can find you. And you're writing a book. Take a few minutes and talk about yourself.
Yes. So basically, I have my own regenerative medicine center called Thea Center for Regenerative Medicine here in Los Angeles. And so that's where I see but in the process of trying to treat patients, I realized I had to kind of take matters in my own hands and have my own company. So that's when I developed a stem cell company called Chara Biologics, so Chara. So Chara is actually a Greek word for joy. So this is the company that we provide a range of products, actually 4 products that regenerative medicine space. So one is the stem cell product I was talking about. The other one is an exosome product, which is really high concentration, very high quality, all third-party tested. And then we have an innovative product for facial resurfacing. So it's a live stem cell product that can be put on the face, and people can run microneedling. So microneedling, a lot of people are doing what's called vampire facial or PRP facial, but this one is a lot more potent than PRP alone, because this has got the newborn's magical, combination of, that's how they regenerate, right? All the growth factors and the proteins. And the last one is a cream that that has a huge percentage of birth tissue extract, and in combination with peptides. Peptides has become very popular and they're very powerful. So I put those 2 together, and then in the all natural form, I insisted on 100% natural. I do not want to include any synthetic ingredients. So it has hyaluronic acid, a lot of herbal extracts and antioxidants and natural oils. So it's so this is all together. So I'm a product developer. I'm excited to make new things because I think I can make something that the world has never seen. That's the best thing out there. How fun is that? And then on top of that, I founded American Academy of Integrative Cell Therapy. We have course every second Saturday of the month. So any doctors or healthcare professionals can come and learn all about how to do stem cell therapy, and we give them a certificate at the end. And then I founded another company that focuses on research, on regenerative medicine research. So we are trying to push out high quality research projects, research protocols, so we can really collect the data and eventually show the FDA, have done, because evidence, I'm big on evidence. We're not just going to stay on the anecdotal stage. Work for this patient, work for that patient. We've got to collect the data and show it so that we can move this field forward, so that this company is going to cover it one day. So it's going to become mainstream.
Very cool. Very cool. And your book.
Oh, my book. Yes, that's a really fun one. It's called Tiger of Beijing. It's about my personal journey. It's only 3 years of my life, but I grew up in China. I came to this country when I was 20 years old. So the book started when I was 20, standing in the American Embassy in Beijing, and getting my visa rejected. So I was full of hope, ready to go to Massachusetts to attend Clark University. I had a nice scholarship. That dream was shattered. And it's about, what do you do when you're facing seemingly insurmountable obstacles? So that's where the tiger comes in, because I got pissed off, because no one is going to tell me that I can't do what I believe is the right thing to do for me. I'm not harming anybody. I'm pursuing what I think my destiny is. So that's when I went on my own way. It's a very interesting story of how I even got out of China. So the first half of the book is how I made it out of China. And the second half was how I survived in this country. So about first 2 years in the US, because things didn't come out the way I had designed. So I was facing another very big obstacle. If I could do that, if I could get out of China when the Chinese government didn't want to leave and the US government didn't really want me to come, I think whatever I'm going to do next is not going to be as difficult.
That's awesome. Well, when does the book come out? Do you have a date yet or not?
Next month in October. Yeah.
Oh, next month.
Yeah. So it's going to be available on Amazon. Yeah.
Oh, cool.
So actually, there's the paperback, hardcover, hard copy, and then I have the ebook, and then I also narrated, the audiobook. So awesome. If someone wants to listen to how I, tell the story, they can also listen to the audiobook. Yeah.
Oh, that's awesome. Well, congratulations.
Thank you.
All right. Well, this has been awesome. This has been a great discussion. And thank you so much for joining me and sharing all your knowledge with everybody.
Sure. Yes. The knowledge, I just said it can benefit so many people. You know, the problem is I see people are suffering needlessly. There are so many tools out there and people are not, they don't know, or they're not paying attention. And it's unfortunate because they don't have to suffer as much.
Right. So the moral of the story is you are responsible for yourself, right?
Oh yeah, you bet. Yeah. The people who don't want to help themselves, as a doctor, I leave them alone.
Right. Exactly. All right. Well, thank you, Dr. Joy, for joining me today.
Of course, Dan. Thank you so much.
You're welcome.